Okay. It's live now. Dr. Monica?
Chitrakala, you're not audible. Chitrakala, what's happening?
Ma'am, 1 minute, ma'am.
Chitrakala, can we start? If Monica is not ready, can I start then?
Yes, ma'am. Yes, ma'am.
Jerani, you start, Jerani.
Ma'am, you are on mute, ma'am.
Anivarikkum vanakkam. Good evening, dear friends. It has been a great pride and pleasure to be here. I have the great honor to have our President Foxy, our past President Foxy, Dr. Ishma, and all the guest of honors and dignitaries here for this journal club of OGSSI. First time any society starting a journal club. We are starting this time. Obstetric Gynec Society of South India has the pride moment to start the journal club, first of its kind. Today we are starting this journal club. Nearly around 24 medical colleges are participating in this journal club. And this is a new initiative we OGSSI 23 team have made to blossom. And we have here all the senior faculties here and our wonderful president here to make this bud to bloom and to flavor and fragrant everywhere. May I start this with a invocation song?
It's my pleasure to introduce Dr. Priya Kannappan, who's going to be the master of ceremony. And she's an executive committee member of OGSSI, and she's a consultant of Dr. Mehta Hospitals and Garbharakshambika Fertility Center. She's got a fellowship in ultrasound and reproductive medicine and laparoscopy. Over to you, Dr. Priya.
Thank you, madam. Thank you for the kind introduction. It is indeed a great pleasure for all of us, as all OGSSIan and OGSSIans. We are very proud to be the first people to be starting the journal club. So all the credit goes to Dr. Jayarani madam, our president. The way to get started is to quit talking and begin doing. So this has come into action because of our president's will. So let us start this program. So can we have our invocation song by giving our credential and worship to our Lord Kamal.
எத்திசையும் புகழ் வணங்க இருந்த பெரும் தமிழனங்கே தமிழனங்கே உன் சீரிழமை திறமையந்து செயல் மறந்து வாழ்த்ததுமே வாழ்த்ததுமே.
Thank you. Now I would like to invite all our dignitaries and our special guests for the lighting of the Kuthuvilakku. It's a magnificent, glorious day. So we would like to begin with the lighting of the Kuthuvilakku. Can we have the... If your action inspires others to dream more, learn more, and to do more, then and become more, you are a leader. So I would like to introduce our President, OGSSI, Dr. Jairani Kamaraj. She's a Senior Consultant Reproductive Medicine of Akash Fertility Center. Madam has been a Treasurer of TAPISAR, an Associate Secretary, the World Association of Sexual Health, and an Advisory Council member of the World Association of Sexual Health. She's been member of the various societies. She's received medals of Best Doctor Award, Rajamani Janaki Raman, University First Prize in Gynecology, Dr. Vadamalayan Endowment Gold Medal in MBBS, Dr. Anantachari Prize for the University First in Medicine for Gold Medal in DGO with the MGR University, awarded the Women of the Year 2010 by the Lions Club, Achievement of Human Service by Exnora 2010, and Madam has been a Women Achiever Award. So we are very proud to welcome you, Madam. Next, please.
Thank you. Thank you, Priya. I have the great pleasure and honor to welcome our chief guest, Dr. Rishikesh Pai, President, FOGSI, for his wonderful presence in midst of his many activities. He has consented immediately to inaugurate our journal club, which is first of its kind. Thank you so much, sir, for being with us. You are a real inspiration for the youngsters and all the people to dispel all the academic knowledge and sharing everybody's experience and their knowledge to share everybody's achievements. And you are really a person who give everybody the enthusiasm to work for. And we really very proud to have you as the President, FOGSI, sir. And to have you here, it is a still more pleasure for us. And sir needs no introduction. He is the President, FOGSI, and the founder and medical director.
Jairani, chodo.
Yes,
Let
sir.
it be.
Over to you, sir. To
Thank you. I'm really grateful to Dr. Jairani. I can see a lot of my better half, Dr. Rishma Pai is there. One of my best vice president, Dr. Sampath Kumar is there, and many of my friends like Dr. Kundavi is there, and then there is Dr. Jyotika and Dr. Geeta Balsarkar, the brain of FOGSI, the journal editor, and a lot of other people. I can't see all of them, but they are all there. So I'm very happy that you have this journal club, and it's one of its first of its kind. And we have got wonderful people like Rishma, Geeta, Kundavi, Sampath, Jyotika, all of them. So it's going to be a great meeting and a great journal club meeting. I was telling in the other day people that the research is very important and publication is very important. In the future, the rating is based on research and publication. So, you must, as youngsters, you should do everything together in parallel, not in series, which we didn't do as youngsters. We were very busy trying to establish ourselves and we never did research. So, now when we are older and wiser, we realize that we should have done more publications. So, I think Sureka is also there in that. Is Sureka around? So, she's our chairman of the research committee. So,
She's trying to join.
Right. So the publication is very important, and you must try to. Our journal, for example, is very, very famous now, and all the editors of the journal, including Dr. Geeta Balsarkar, who is the present editor, have strived to make it so popular. It is indexed as well, and so we have to also not only do proper research but publish it in very well-known journals also. So that gives you that extra brownie points. So I don't want to get too much and take your precious time, but I would like to congratulate all of you and wish you the very best for this wonderful journal club meeting. Thank you for inviting me.
thank you, sir. Thank you for your kind words. And definitely, as you rightly said, a lot of Indian data are needed, sir. We are doing a lot of work, but we are not publishing. Though we rely most on the Western research papers, but we have a lot of difference between our ethnicity, our cultural basis, and all our living standards. Everything is different from the West. So definitely we need a lot of research papers to be published, which will help us for the future generation to look into the data and practice with an evidence-based practice medicine. So in this way, we all will do the best. All our youngsters are here. They're all there to do it in the best way, to bring all our dreams and wishes to come to the forum in the future. Thank you, sir. Thank you for your greetings and felicitations. And I have the great pleasure and honor to introduce and welcome our guest of honor, the dynamic Dr. Reshma, who is the past president of Morgs and Izar and IAG and Foxy. And she's the consultant gynecologist of Lilavati Jaslok Hinduja Healthcare Hospitals. Madam is a recipient of so many awards, and she's a dynamic person with a smile and effort and efficiency. We have seen a lot of work with her in her dynamic leadership in all the forums. And she has received more than 50 outstanding women healthcare awards. And she's a real women achiever, to be in a short word to say. And she's the women behind our Foxy president to give it still more a brightness and still more the greatness. Over to you, madam, for your felicitation of our journal club.
Thank you. Thank you. Good evening to all of you. Such a pleasure to be here today. And I really prioritized this evening and this moment over a lot of other commitments that I had, basically because this is a very, very important issue, very unique and original issue, first of all. Secondly, some of my closest friends are here, Dr. Jairani. We've been, friends for many, many years. Dr. Sampat Kumari is here, the, very, very energetic vice president from the South, and Dr. Jyotika. So many of my good friends are there, Dr. Kundavi. So I think when all of you join together and initiate such a fabulous thought process and bring together young people who are our future, it's going to be really a wonderful journey beginning so beautifully. So really big congratulations to all of you on the launch of this very nice practical training program. I believe a lot of postgraduate students and fellows are going to be joining in. I really believe that knowledge is the greatest power, as it really helps us to convert our ideas into reality, and it helps us to reach the success that we desire. So without knowledge, we are nowhere. And I'll just share something which I actually experienced yesterday. I met a doctor who literally came from a small village 3 hours from Bhubaneswar, Orissa, and he had his he had a beautiful book laid out on the table in front of him, which he shared with me. He came from literally a hut, ragged, thatched roof hut. And that was put on his, a hardcover book. He had printed it. That was the house he came from. And then he put a big arrow, which said inside it, knowledge. And from that hut, because of the arrow of knowledge, he is now the leading dermatologist, not only in the country, but in many parts of the world as well. So he's the #1 dermatologist of this country. And the arrow said knowledge. That is what I'm trying to say. That is where knowledge can take you from nothingness to everything. It can give you huge success. And I really I was so inspired by this that, I feel that each one of you can change your life, can change your journey, can change who you are just with the acquisition of knowledge. So I'm glad that many of you will be joining in, sharing ideas, reading updates, and improving your skills, and obviously then passing them on, the benefit of this knowledge, to your patients whom you'll be treating now and in the future. My son Arnav is also becoming a gynecologist. He's a postgraduate student right now, and he often tells me, I'm going to invest in stocks. I want to make a lot of money quickly. Doctors don't make money for a long time, and I really, like a typical old parent, tell him that an investment in knowledge pays the best interest. So, and this really is true. So thank you all for your energy, for your enthusiasm, for the initiative. Wish you all the very, very best. I'm sure this will go very, very far. And congratulations again, Dr. Jairani, for this initiative. All of us are with you. If at any time you want us to join in, we are there to be with you to share our experience over the years. So congratulations and best wishes to all of you.
Thank you, Dr. Reshma. Thank you for that wonderful, inspiring speech. And I really thank a lot from my bottom of heart that when I asked, immediately you accepted. I know you had a very important family function. You said that I'll stay back, I'll just say a few words. And that is the inspiration of the senior people to give us the guidance and the initiative. And I really thank you so much on behalf of my OGSSI 23 team. I thank you and sir for being with us, which gives us energy and strength to work forward through. Thank you so much for being with us.
Thank you so much. All the best.
Thank you, thank you, thank you. So we now have the special guest here, Dr. Geeta Balsekar, who is a friend of mine, who is a great academician, who has a lot of laurels in her research-oriented work in Jogi. And she is here to felicitate her. She is a professor unit chief of the Nauroji Wadia Maternity Hospital, Saint GS Medical College, Mumbai. And she's the present treasurer of Mumbai OBGYN Society of India. And she's the editor-in-chief, Journal of Obstetric and Gynecology of India. She was the past president, Association of Medical Women of India, president, Mumbai Menopause Society. And she's a chairperson of Young Talent Promotion Committee of FOXI 2013 to 2016. And she's the recipient of Hargobind Foundation Fellowship for Study of Fetal Medicine in 2008. Welcome you, Geeta, and thank you for joining us and giving us your special felicitation.
Thank you very much, Jayarani, and congratulations for having this unique initiative. I'm sure it will benefit a lot of postgraduate students. Our journal is on the must-read section of all the Tamil Nadu University. So, I'm sure all your postgraduate students will be reading the journal. Journal comes out every 2 months. So we have 6 issues in the journal, and they're expected to read the 6 issues of all the 3 years. It is in the must read section of the Diplomate of National Board, the DNB, as well as on the Tamil Nadu University. So all your postgraduate students have to read the journal before they go for their exam. And I also invite all the young people to publish their thesis in our journal in the appropriate, if they read the instruction to the contributors and they write in the proper manner, I'm sure it's not very difficult to accept the articles. And I wish you all the best. And I hope that more and more students will join you. And I won't take much of your time, and have a good learning. Thank you.
Thank you, Geeta, for your kind words and your presence, which is really a inspiration for the youngsters and the postgraduates. And I have the great pleasure and honor to introduce and invite and welcome Dr. Jyotika Desai, who's a senior consultant, PR Desai Hospital, Bangalore. Madam is the chairperson of IMS Education Committee between 23 and 25. And she's a DNB teaching faculty in Bangalore. And she's the honorary secretary of ISABAB Bangalore chapter. And she's a chairperson of the website committee IMS 21 to 23, past president of Bangalore Society, past president of the Bangalore Menopause Society, and she's the FOXI South Cone Quiz Coordinator from 2012 till date, and she's the scientific chairperson of ACOG 2019, and she has recipient of a lot of gold medals and awards, and it's been a great pleasure to have you, ma'am, with your knowledge and your experience to share and to give us a guidance for this initiative of OGSSI 23.
Thank you, Dr. Jayarani. I'm really honored to be part of the inception of the Journal Club by OGSSI. Research, as we all know, is the foundation of medical practice. I always feel that the pulse of any conference is the number and quality of the free papers which are presented. Sadly, they are the sessions which are least attended. It is heartening to know that the medical boards have made publications mandatory for postgraduates, so that at least, this way they will be doing some research. However, instead of presenting just case reports, and prospective studies should be encouraged and presented. I congratulate OGSSI again for taking up this very progressive initiative. All the best for you, and thank you very much for involving me in this very important step which you have taken. Thank you so much.
Thank you, madam. Thank you for your kind words. And we look forward to have your help and guidance in our clinical research committee to work well forward with most of your experience to be shared and guided, ma'am. Thank you so much for joining us, madam. I have the great pleasure and honor to introduce my dear friend, Dr. Sureka Tayade, who is a professor and unit head of JNMC Swangi Vada teacher, trainer, guide, mentor since 20 years. She's the present chairperson of the FOXI Clinical Research Committee. She's the West Zone Coordinator of the Practical Obstetric Committee of FOXI. She's the Member Education Committee of IMS and the chairperson of Global Women's Health Task Force Network of USA TUFH. And she's the core faculty of DIRA project of FOXI. And she's the founding member and vice chair of the Women in Health Together for the Future of South Africa. And she's the national mentor and quality improvement of Lakshya program and also the GOA program. And she's the master's trainer of emergency obstetric care and critical care of and maternal near miss GOA. And she's the co-leader for the maternal near miss project, national and state rollover. And she has a lot of publications, both national and international. And she has authored many chapters in books and publications. And she has a lot of projects to be done. And I mean, she has done, and it's a real honor to have you, Surekha, here for the inauguration of our journal club. And definitely your knowledge will be definitely guiding all the postgraduates and all our members through this pathway. Over to you, Surekha, for a few words.
Thank you. Thank you, Dr. Jairani, and dignitaries on the dais and off the dais. My all the respects to you, and especially to this OGSSI team, I think. And we have Dr. Fundavi, we have so many people. We have Dr. Sampat Kumari, and all the OGSSI team. I think it's a wonderful, wonderful, endeavor. Starting a journal club itself. You know, when we talk of clinical research, this is one of the arenas which is most neglected, I think, but is very
Surekha, I think your network is weak, I believe.
Yeah, because I can't see. Now she's come back.
I got off from
Ma'am,
institute, and I'm sorry, I got
your
off
network
the
is little weak,
internet.
I believe.
I'm still
Your internet is weak,
I think-
Surekha. Why don't you cut the video and talk? Yeah, you can cut the video and talk so that it'll be better.
Previous meetings which we had, and I was just saying that clinical research is so important because it guides clinical practice, and we should be more coming into all our trainees should be, initial whatever training we give to our postgraduate, we should always be talking to them about how to conduct research and how to, whatever existing research is there, how to appraise that research and bring into the clinical practice. And the journal club is very, very important, for postgraduates, for early clinical individuals to learn how existing, knowledge can be brought into clinical practice. And that's why I think this endeavor is very, very important, and especially training postgraduates. I think Dr. Jairani, you have done a great job of starting this. And then, of course, we always get inputs from professors, and everybody is joining, to, threadbare discuss that journal, that article. That's, I think, very important. And I always said that FOXI's Clinical Research Committee would like to collaborate with OGSSI in this endeavor and take this forward. When Dr. Priya called me, I said yes, we would like to join, because then we can bring in some national faculty also in this fact. Of course, Dr. Jairani does have a lot of connections everywhere in the nation, but we as Clinical Research Committee also would like to join and give our bit of contributions to this endeavor. So congratulations and all the best for this endeavor. Yes, gaining knowledge is important, but whatever existing, we should be publishing our own data also. So that is also very important, and that is what we should learn. So thank you very much and all the best for this endeavor.
Thank you, Surekha, for your nice, inspiring words. Definitely, as you rightly said, that we all want all the research publications, everything to be started, and we really want to collaborate with FOXI and all the senior faculties like you to guide us and to make this a good initiative to go a long way with the good inputs and good improvement in the clinical research. For this only, we are today starting this journal club with the first talk about the clinical research methodology, which is a real thing of all the postgraduates and the clinicians and the practitioners to understand and know about it with a proper in a proper way, we have started this. And I thank you so much for joining us. And we hope and look forward to work in collaboration with you. Definitely all our postgraduates and all the medical college students and the practitioners will be benefited with your guidance. Thank you so much for joining, Surekha. And over to Priya.
Thank you, ma'am. So I would really thank our chief guest and our guest of honor and the special guest. Thank you. Thank you for making this event very special. So it is my duty to come and introduce our chairpersons. They are the very special people. Dr. Sampat Kumari doesn't need any introduction. We all know she is the very loved, enthusiastic vice president from the South. Madam is a professor of Sri Muthukumaran Medical College Hospital and Research Center and the vice president currently. Madam is a Senate member of TN MGR University. She's a national corresponding editor of Jogi, founder secretary of TNF OG, and she retired from the government service from MMC. Madam is a president board of studies for the Tamil Nadu MGR University 15 to 19. Chairperson Foxy Adolescent Committee between 2016 to 18. First ICOG. Okay, madam, welcome to the program. Next scene. It is my pleasure to introduce Dr. Hepzibah Madam. Madam is my teacher, my mentor. It is my great privilege for me to do that. Madam has been the former superintendent of Stanley Medical College and a professor of Savitha Medical College, a past president of OGSSI and president of the Chennai Menopause Society, past president of Menopause Society Education Committee chairperson, and she's been a research member secretary of Savitha University, conducts awareness programs for Tamil Nadu paramedical staff schools and colleges. Madam has presented more papers. Nobody can have so many awards like what Hepzibah Madam has. So like, all the awards, if you say, I think the whole program will not have time at all. So Madam has been into research. Everybody knows that. And to start the program with Madam as a chairperson, it's a very honor to us. So welcome to both the chairpersons. And some Jairani Madam wants to add.
So we want to add up one more best laurels for Madam. Madam is the first DSE. She is the first DSE holder, more than a PhD. That is the best thing for Madam. She's a DSE holder, almost, I don't think only a hand, I don't know, a handful, maybe a countable one will be a DSE holders in the medical profession. And we are really proud to have Madam to be the first DSE holder, I think maybe from India, first time. Thank you, Madam. Thank you for being with us.
Thank you, ma'am. So over to the chairperson to introduce the speakers.
Actually, it is a great pleasure and honor to be associated with OGSSI. And I should congratulate Dr. Jairani for this wonderful initiation, because the research we are lacking so much in research activities, and for the young gynecologists and for the postgraduates, because in Journal Club, we always discuss about the peer-reviewed journal. So we know what is the latest evidence, and they know how to critically think about any article. The strength and the limitation they will know. The critical thinking skill will improve. So it will be useful for their own research work. So I really, really congratulate for thinking about this initiative, and hats off to you people, and may God bless you. And you have to continue all this work. People are doing a wonderful job. President Dr. Jairani and the Secretary Kundavi. I think you people have no time to sleep, I think. So congratulations. And before we, not much, I don't want to take much of your time. And shall I introduce this Sambat, Dr. Nikita?
Yes, madam. Yes, madam.
She's a graduate from St. John's Medical College, and she has a dual degree of MBA from Annamala University. And she is also done a course on research methodology. And she's currently the regional medical advisor of South at Abbott. I think you people have chosen a right person to talk about research methodology. Over to Nikita.
Thank you so very much, Dr. Hepzibah ma'am. Absolute pleasure to be introduced by such a big stalwart. A very good evening to all of the dignitaries present and all of the participants. A warm welcome to you all to our very first Journal Club session. I'm just going to begin sharing my screen. I won't take up too much of time introducing myself because I believe Madam has already said everything there is to say about me. I look forward to all the future sessions of OGSSI as well, in association with OGSSI with regards to clinical research methodology. So with that, shall I begin? Dr. Priya, shall we go ahead?
Kindly go ahead.
Perfect. Thank you so much. Do feel free to enter any questions or any queries in the chat box, and we can take them as we go along or perhaps towards the end of the lecture. Whatever seems more feasible, we can do that. So with that, let's begin the first module of the clinical research methodology. I will primarily be covering how to frame the right research question, selection of the right clinical study design based on the research question, and a little bit about measures of association. What is clinical research? Clinical research is being conducted every day around the world for the advancement of medicine, and it is primarily a branch of healthcare science where we are able to understand, determine the safety and efficacy of any medication, any treatment protocols, devices, diagnostic products, and it is the way forward because it is a way of self-improvement. Not only are we challenging the existing gold standards, but we are coming up with, I would like to say, platinum standards for treatment of care. So when we have to go about conducting a clinical study, what are the primary steps that we look at? Number one, we define what the research problem is, identify existing gaps, improvise these gaps by answering various research questions and analyze new evidence that is present. The step two is, according to the question that we have selected, collect the data by preset methods. And finally, our last step would be analysis of the data by statistics. So that brings us to the first portion of our lecture. How do we formulate a research question? At this junction, I will ask the participants, can you tell me what is a hypothesis? Because I'm pretty certain that at some point in our PG career, we would have heard this word hypothesis. You need a good hypothesis. If you want your paper to be good, if you want your paper to be published, you require a good hypothesis. Can anybody either unmute or mention what is a hypothesis? I'm going to give it a few minutes. Otherwise, I'm going to move on. Anybody? I believe we were just starting the session and it was already discussed that it is a dry topic. So students, I will urge you to please respond because I can only do so much to make it interactive, but we can make it interesting for ourselves if we get it off our mind that research is a dry topic. It is not. It is actually what do I say? There's so much potential here when it comes to research. So there's no harm in giving any wrong answers. We're all here to learn. We're all here to improve our knowledge. So I see there is one answer in the chat box. Oh, we cannot unmute. Apologies there, Dr. Sitesh. But you can type in your message. Can anybody tell me what a hypothesis is? Because I'm pretty sure your guides also in the hospital, wherever we're doing our post-graduation, they would have said, come up with a good a hypothesis, Dr. Sitesh, because that's the only way to get in a good paper, right? Right, so I'm going to go ahead this time, but I'm not going to let the students off the hook. I'm going to keep coming with my questions. Yes, great, okay. So a hypothesis is primarily any theory or any idea, simple as that, right? Any phenomenon which you come across in our day-to-day life, in our clinical practices, which you would like to test out, a theory of sorts. When you begin to test out this hypothesis or this theory, thereby you have given birth to a new research paper or a thesis. So, so where do we begin? First and foremost, when we are entering into doing a thesis or a research paper or a study, the first step would be to conduct a good and comprehensive literature review. I cannot stress the importance of extensive literature review because there is no paucity of data. There is a vast amount of data which we have the access to, and it is a privilege indeed because back in the day, if we can talk to our professors in college, they will tell us what a task it was to do literature review because you had to go through very big fat journals to go through different sort of papers and actually come up with a good hypothesis. But now we are living in a generation, in a digital age, where we are the privileged generation, right? Where we have access to information at the tip of our fingers. So literature review, it's extremely important. I'm not going to get too much into this because I believe we have Dr. Sudarshan to talk a little bit more about this, but please, literature review is extremely essential. So with that, we're able to come up with the next step, which is a good hypothesis. And with a good hypothesis, the first step to a research question, paper would be to formulate a good research question, because based on that, you can decide what study design you'd like to undertake. Now, so the wonderful thing about research question formulation is, unfortunately, as students, there is so much pressure on us. We tend to take it into our head that there is, how do we come up with a question? Is this going to be something worth publishing, or would it be possible for me to, even venture out into this question and make it into a research paper? It's something which is as simple as a coffee house conversation, right? Here, I believe we have a conversation between two medical professionals where one doctor says, PPAR gamma agonists, or peroxisome proliferator activated receptors agonists, show some pleiotropic effects on vasculature and inflammatory pathway both. So that is the drug here in question is pioglitazone, as we know, is a very, very famously known anti-diabetic medication, right? So then the doctor says, okay, so it looks like it can act as an anti-atherogenic and anti-inflammatory. So this doctor comes back and says, why don't we test the efficacy of pioglitazone, or the effect of pioglitazone on vascular function in patients with rheumatoid arthritis? So in doing this basic discussion of back and forth, of exchanging and throwing ideas off of each other, bouncing ideas off of each other, they've come up with something of a basic idea of a research question. So that brings us to, what are the sort of questions that go through our mind when we're framing a good research question? Number one is, what is a research question? Why do we need a research question? How do we develop a research question? How do I know that a particular research question is a good enough question? Or what do I do with this research question? So before that, we can understand, let's try to understand what is the difference between a research topic and a research question. It's as simple as this. If somebody can mention this in the chat box, that'd be great. Can you tell me what is the difference between a topic and a question? So I'm going to show you once again, a topic and a question. I believe the action should speak louder. Okay. So I will elaborate. Research topic is nothing but our broad area of interest. For example, I've taken the example of postpartum hemorrhage. Now, that broad area is a postpartum hemorrhage is the topic. Research question would be, in postpartum hemorrhage, what exactly would you like to look at? Would you like to look at medications? Would you like to look at diagnosis? Would you like to look at prognosis? Would you like to look at which aspect of postpartum hemorrhage are you looking at? So here I've specifically asked or looked at carbetocin in the management of postpartum hemorrhage. Okay, so that is post streamlining. I've come up with, from the broad area of postpartum hemorrhage, I've narrowed it down to carbetocin in the management of postpartum hemorrhage. So when it comes to answering the question, why do I need a research paper? Is it possible to explore the entire topic? Most certainly not, right? Topics are so vast. We cannot have a paper that says postpartum hemorrhage, the end. There has to be some amount of streamlining. And in a given topic, multiple research questions could be asked if we have the right sort of thought flow. So it's important to be specific and focus on a particular question alone. How do we do that? First and foremost, select a topic. It can be anything. It can be, for example, I've taken postpartum hemorrhage. It can be, endometrial carcinoma or endometriosis or cervical carcinoma, or even something like pap smear. Anything, even diagnostic tests are also, something that you can venture into. So narrow down that topic that you have, list a couple of questions that you can come up with regards to the topic, select one of the question and focus only on that question. And that would be a good process of sorts to get started with framing a research question. Again, begin with literature search or review. I'm not going to get much into it, but this is I've given an example of one of the journals, one of the libraries here called Laurier, where I have used to search on the topic of thyroid cancer. I'm not going to get too much into it, but just to emphasize that it is indeed extremely important to have extensive literature review. Now, how do I develop a research question? You can brainstorm ideas, try to find missing links in the existing therapy or existing disease space, or you can try and connect the dots of where in an existing therapy area, or you can organize your thoughts. Like for example, here I've created a concept chart around thyroid cancer, specifically around treatment. So I've looked at either surgery or radioablation or radiotherapy, and then I've broadened it out to see if I want to get into within radiotherapy. Am I looking at metastasis? Am I looking at recurrence? Am I looking at genetics? Ablation? Am I looking at recombinant TSH or thyroglobulin monitoring? What am I looking at? So this sort of concept charts also help you come up with a specific research question. How do I know it's a good research question? You can just check if it's a workable idea. So do a quick search and find out if your topic is too broad or too narrow, right? There is something called too much of a broad topic, because data collection will become an issue. Publication time, it might become too much of an issue, so you just need a topic that is not too broad, at the same time not too narrow. If it's too specific, you'll find it hard to find the right kind of samples for your study. So that's why you have something called a finer criteria to fine tune your research questions. So these are the things you kind of look at. F is it feasible? I, is it interesting? I wouldn't focus too much on the interesting because see, end of the day, it's what interesting is something that's very subjective. What is interesting to us might not be interesting to the next person. So I would say look at something that is feasible, novel, ethical, most important, and of course, relevant. So does it have to be that the study has to add something new? Absolutely not necessary. There is something called seminal research papers, which is something which is a new contribution to knowledge, where they've come up with a brand new drug, or they've made an excellent observation. That is new contribution to knowledge, and it's relatively rare. Now, that does not have to be the case with every research paper. There are research papers that can just be added to the pile, which can add incremental value to an existing study. Let's say a study that's been done in India, or let's say a study that's been done in South America, and you'd like to see the effects in an Indian population. So you've extrapolated the data, thereby making that study more generalizable by extending it to a new population. So you're only increasing the confidence in the validity of the previous study. So always remember, please do not feel pressurized to come up with new topics or new seminal research papers. You can always have papers that add value to existing validity of existing research topics. So primarily clinical research questions fall into two distinct categories. Number one is about the effectiveness of treatment, whether one is better than the other, or the more often than not, our students come in the second category, which is understanding the incidence of a disease, prevalence of a disease, or of a clinical phenomenon, risk factors, diagnosis, prognosis, looking at a specific clinical outcome. So these are the things which we more often do. The effectiveness of a clinical of a treatment, it comes under a experimental study. If it is done, it would be amazing, well and good, but more often than not, it's the second category that the students would take. So primarily when you're talking about turning the research question into a proper proposal, these are some of the questions that should come to your mind. Number one is, what is the sample size you would look at? What are the statistical tests you would take for an analysis? What are the chances of confounding that are then that can come into the study, and are there measures taken to minimize the confounding factors? What information was collected ethically? Again, when it comes to confounding factors, I'll come to that a little later to explain what exactly confounding is. Then, so these are the few questions that come into your mind to say, okay, now that I have an idea of what I want the research paper to be, these sort of questions have to be answered. What is the intervention? Who are the participants? What is the outcome that I'm looking at? So when you answer these questions as a check in your mind, you will be able to come up with an effective and a good research question. To shorten it, there is a what do you call it? A short form called PICOT or PICOT. So PICOT helps us remember the structure of a research question, where P stands for patient or population, I stands for intervention, C stands for comparator, O stands for outcome, and T is the time or duration. A good and a correct research question has all these components of PICOT. PICOT, patient or population, intervention, comparator, outcome, and time or duration. Not necessarily in the order. So here I have formulated a research question. Can anybody tell me? I'm going to read it out. As I read it out, I would urge the participants, enter in the chat box, what is the P, what is the I, what is the C, what is the O, and what is the T. So in this question, is 45 milligram daily pioglitazone for 3 months effective to improve vascular function and to decrease disease activity in non-diabetic adult RA patients on stable RA standard care of treatment in comparison to placebo? So what would be P here? What would be the patient population that we are considering for this study? What would be the I, or the intervention that we're giving? What would be the comparator or comparison group that we have taken up? And what is the time period for the study in this question? Anybody? Now, one person doesn't have to give all the answers. Somebody can give P, somebody can give I, somebody can give C, somebody can give O, and somebody can give P. Anybody? P is non-diabetic RA patients. Perfect. Thank you, Dr. Mathura. So, P is absolutely right. Non-diabetic adult RA patients. Then, what about I? What is the intervention that we are giving here? I'm very relentless, by the way, doctors. I am not going to move until I get some answers. So, you are going to only lengthen your, your session. Thank you. To find out new drug for RA patients. No, here I have put, yes, I is 45 milligrams of pioglitazone. Thank you, Dr. Vardhani. Comparator, adult RA and non-diabetic patient. No, that would be the patient population. Comparison is, I have taken the intervention, which is pioglitazone, right? That is what I'm giving as an intervention. What am I comparing it with? Placebo, right? I'm comparing it with the placebo. So C will be placebo. And what is O? What is the outcome I'm looking at? By giving pioglitazone, what is the primary outcome I'm looking at? Thank you, Dr. Vardhani, once again with placebo. Now, what is the outcome I'm looking at? I want something to happen to these patients, right? What is the outcome I'm looking at? To improve vascular function. Perfect. Thank you, Dr. Kundavi. Thank you, Dr. Vardhani. So to improve vascular function is my outcome. And what is the time period I've taken up for this study? I have two answers. Yes, 3 months. Perfect. So have I covered all PICOT in this questions? Yes, I have. Has it been in that order? Not necessarily, but we can see PICOT in this question, which makes it a good basic research question, right? All right, let's move on. So to begin with, we need extensive and good literature review, a good hypothesis, and finally, a good research question. With this good research question comes the question, what type of study design do I take? That completely is dependent on the type of question that we have taken up. Which brings us to the next part of our topic, which is clinical study designs. I'm going to take a little bit about what are the different types of clinical study designs. This might be a useful slide actually. So I'm just going to see if I can minimize these things. I hope the whole slide is visible. So based on whether or not, okay. All right, just a moment. Right. So based on whether the investigator has put in an intervention in place or exposure in place or not. If there's no intervention, that we are not making a study where there is an intervention in place, right? Then that becomes an observational study. We're only observing certain patterns in the existing system. If we are looking at giving an intervention, for example, I'm trying to test whether this drug is good or not. So I'm going to give the drug to the patient and then I'm going to look at outcomes. That is an intervention or an exposure that we are giving. That becomes an experimental study. Under observational studies also, where we're only observing, we're not giving any intervention actively, depending on whether we are having a comparison group or not, it varies. So if there is a comparison group, then that becomes an analytical study. Now, if there is no comparison group, we're just continuing to only observe a single case report or case study, that becomes a descriptive study. Under descriptive studies only, we have case reports and case series. Now, under analytical studies, wherein we are observing a certain group of patients and we're trying to look at the difference between the outcomes, there are 3 types of studies. What are the 3 types? Cross-sectional, cohort, and case control study, right? Now, the difference between these 3 is the direction of the study. E and O that I've mentioned here is basically exposure and outcome. Exposure is nothing but the risk factor or whatever we are looking at. E is, for example, in the case where we are looking at a patient who smokes, who eventually develops lung cancer, for instance. That is what we're trying to observe. Smoking would be E, exposure. Outcome would be lung cancer, right? So if I'm looking at E to O, meaning I'm collecting a group of patients who are smokers, and I'm trying to understand whether they develop lung cancer. That is E to O. That direction will be a cohort study. If I'm looking at outcome, if I'm looking at lung cancer patients and then looking back to see if they're smokers, from outcome to exposure, that becomes a case control study. And if I'm looking at outcome and exposure at the same time, a group of patients to see how many of them have lung cancer and those, how many of them are smokers at the same time, at a given time period, if you're looking at both together, it's called a cross-sectional study. So these are the different types of observational studies. When it comes to experimental studies, based on whether we randomize our samples or not, it's called a randomized control trial or a non-randomized control trial. So this is the broad classification of the different types of studies. So the hierarchy of evidence, right on top will be the systematic reviews and meta-analysis of the RCTs. Below that will be randomized control trials, then cohort, case control, cross-sectional studies, and lastly, case reports or case studies. Now, this is a hierarchy of evidence, but it does not minimize the validity of any of the studies. Now, if somebody is going to undertake a case study or a case report, that is also very important with regards to improvement of knowledge or understanding anything about a particular disease area, as equally important when compared to randomized control trials. But in terms of hierarchy of bias, there's higher chances of bias when it comes to case reports and case studies, and lower chances as we go higher in the pyramid. Likewise, quality of evidence will be higher in cases of randomized control studies or higher up in the pyramid as opposed to case reports. Why? Because the randomized control trials are done in a very controlled clinical environment, right? So there's a lot of inclusion and exclusion criteria in place. So there's very little room for error. So the quality of evidence is regarded to be much higher in case of an RCT or cohort study, as opposed to the lower case reports, which is mostly based on questionnaires and surveys that we conduct and take from the population. So primarily when we look at a clinical study, there are two directions. Based on the direction of the study, it can be called a prospective study or a retrospective study. Prospective study, as a name suggests, is one that is looking forward. So we are collecting data of patients, so we're collecting cohorts of patients and we're following up with them with a period of time and then looking at whether the outcome occurs. That is a prospective study. An example for this would be a cohort study. Now, a retrospective study is the data which is collected from past records. So we have patients already with the particular disease. We look at their past records and try to understand if there's any association between this particular risk factor and the outcome that has occurred. Mostly that is done in a case control study. So based on the objective of the study that we are undertaking, we have, for example, if you're looking to understand the prevalence, cross-sectional study would be most appropriate, as we learned in our community medicine, right? If you're trying to understand the incidence of a disease based on a particular risk factor, cohort study is the study to go for. Cause all three can be undertaken. You do case control, cohort, or cross-sectional study. But once again, the reliability based on the pyramid of hierarchy, right? Cohort is on top, then case control, then cross-sectional. If you're looking at prognosis of a disease, naturally, it's a prospective study, it will be a cohort study. Again, natural history, prospective study, so cohort study. Treatment effect, you're trying to look at a comparator and a drug that you're trying to look into for the safety and efficacy. It has to be a randomized control trial. So based on the objective, you have different types of studies. Once again, I have highlighted this, which I've already explained: exposure to outcome, cohort study; outcome to exposure, case control study; outcome and exposure at the same point in time, cross-sectional study. So which brings us to what is a descriptive study, right? A descriptive study is one which helps us understand to get the lay of the land. It just describes certain events or certain outcomes which you have observed in a patient. How do we get this? By means of surveys. For example, I've taken the example of how many women in Kolkata are prescribed thyroxine in 2015. This is an observation that we're making based on surveys. Now, this can be used to describe a novel phenomenon, right? For example, when COVID outbreak happened, primarily it was descriptive studies that were undertaken initially before our vaccines and all of these came into being. It was an observational study, right, to see what is happening and what are the categories of patients who are most susceptible to this, and what are the sort of outcomes that is ultimately leading to somebody being infected with COVID-19. These are the at the initial stage, you can only start with a descriptive study, right? So these include case reports and case studies. Example I've taken here is effect of octreotide on endometriosis and acromegaly. Those are very specific, right? So you cannot establish a causal relationship. You cannot for sure say that, yes, indeed, this causes this. You cannot. Smoking causes lung cancer. We cannot say this with the descriptive study. However, the beauty of a descriptive study is, if you have any doubt, based on the descriptive study, you have gotten some absolutely phenomenal epiphany, you can do an analytical study, or you have to do an analytical study to actually have a comparison group and try and establish this hypothesis in a more strong manner. So you have to, once you finish a descriptive study, let's say you've gotten a wonderful outcome and you actually want to test this out, you have to go back into a case control study and look back at the records, and then you'll be able to have a more established and firm and more reliable quality of evidence. Is it important, descriptive study, because it seems like it doesn't do much? Yes, it most certainly is, because it's important in describing trends, and it generates hypotheses about novel associations, because it sort of lights a bulb in our head saying, hey, maybe this is associated with this. Maybe somebody for all this, did a descriptive study and then understood the association between smoking and lung cancer. It didn't just happen by chance, right? So it starts somewhere, and that somewhere is a descriptive study. So it brings us to case studies. Now, the first type of descriptive study is a case study or case reports. These are individual cases. So it primarily involves a detailed clinical evaluation of this individual case to study the relationship between a possible causative factor and a disease. And it will be extremely useful for those which are uncommon diseases or those which are caused by a single exposure. For example, vinyl chloride causing angiosarcoma, or diethylstilbestrol and clear cell carcinoma of vagina. These are single exposures and uncommon diseases. So case reports would be most beneficial here. Case series will be when you have several patients with the same disease. When you have them together, it is a case series. So many case reports together is a case series. Now, one interesting tidbit about the case series is just to encourage us to not take it for granted, or not think that just because it's a descriptive study, there's no value. No, never think that. The WHO initially, not WHO. Initially, there were a lot of consultants worldwide who were noticing an association between men specifically who were homosexuals and intravenous drug users, and an association between neurocystis carinii infection among these category of patients. And they found it very strange, because it started with one, it started with two, and then it became a case series. And they were trying to see, are there any other risk factors? Are there any other association between neurocystis carinii and, these particular group of patients? And eventually they found out something very useful, which led to us having the current, standards for diagnosing a patient with AIDS, or rather saying, these are the possible risk factors which are there for AIDS. It all started with a case series where somebody noticed that there's some association here between neurocystis carinii infection and a homosexual person. So never take case series for granted. It can be extremely useful in capturing something so insignificant, which we might think is insignificant, but in reality, there's a lot of potential. So case control study, it primarily investigates the association between a particular risk factor and a disease. I'm establishing here the word association. Okay, we cannot talk about causation. We can only say maybe, because you're looking at outcome first, and then you're looking back at exposure, right? So even in our case of lung cancer, which I've taken here. So this is the point in time where we're doing the study, okay, where the cases are there, the controls are there. So our data is, cases are those who have lung cancer, controls are those who don't have lung cancer. We're going to look back at their records and see, among cases, who's a smoker, who's a non-smoker, among controls, who's a smoker and who's a non-smoker. And then accordingly, we can come up with our statistical analysis. We come up with certain p-values and things like that to say, okay, there is a significant amount of association between smoking and lung cancer, because see, the blue is representing smoking here. Okay, so just for a pictorial representation, we can see that the cases have more blue and the controls have less blue, which means maybe there is some kind of association between smoking and lung cancer. So we can only talk about the possible association between a factor and a disease. So this again is a retrospective study. What are the disadvantages and advantages? Advantages are, it is useful for rare disease outcomes. It is useful for new diseases which we are not aware of, useful for outbreak investigations. If induction period is long, for you can study multiple exposures. So again, when we look at lung cancer patients, for example, it's not just smoking. You can look at literally any risk factor you want. You can look at age, you can look at gender, you can look at other possible risk factors, like not just nicotine, maybe alcohol, or working in a particular setting, or anything can be looked at. And it's also relatively inexpensive naturally, right? Because we're looking at records. What are the disadvantages? We are selecting the cases and controls, so there is some amount of bias that can come into play. There's susceptibility to exposure, misclassification, all of the recall bias, which all again comes with the fact that we are selecting these ourselves. It is restricted to a single outcome, naturally, because we are selecting the cases based on outcome, right? So we are restricted to a single outcome, and also we cannot calculate incidence rate. So we cannot say among smokers, the chances of a smoker developing lung cancer is this much. Incidence rate cannot be determined in case of a case control study. Next is a cross-sectional study. A cross-sectional study primarily at a given point in time examines the relationship between disease and other health characteristics at one point in time. So exposure outcome at the same time. Now, it is through these studies that we can primarily look at prevalence or risk factors. Or if you look at our community medicine department, or WHO or UNICEF, all these big bodies, when they're at any outbreak happens and they're trying to understand the prevalence of a disease in a given population, in a given country, in a given region, it is a cross-sectional study that is undertaken. What are the pros? It's cheap, it's simple, it doesn't take too much time, it's ethically safe, and there's no loss to follow up because everything is done at one point in time. What are the disadvantages? You can again only establish an association. You cannot talk about a causation. There is recall bias, there is social desirability bias, researchers bias, many biases come into play here, and confounding factors will not be equally distributed, and it's not at all appropriate for rare outcomes. So this is primarily a cross-sectional design, study design. So this is a population at this given point in time. We are going to look at who has a disease, who doesn't have the disease. Among those who have the disease, who has a risk factor, who doesn't have the risk factor. Among those who don't have the disease, who has a risk factor, who doesn't have the risk factor. All of this is done at the same point in time. So there's no following up with them over a period of time until they develop nothing. At a given point in time, who has a disease, and in those who have the disease, who has a risk factor. It's as simple as that. So again, there are types of cross-sectional studies. There are descriptive studies and there are analytical studies. So when it comes to descriptive, for example, you're here only trying to assess the burden of a disease in a given population. So I've taken the example here is, what is the prevalence, for example, of bronchial asthma in a random sample of school children in Bihar between the age of 10 to 14 years. So what is the prevalence of bronchial asthma? That's it. I'm only trying to understand prevalence. But when it comes to analytical study, you have to actually see and investigate whether there's a possible association between a risk factor and an outcome. And both are measured simultaneously. So example is, I've tweaked the same question to say, what is the prevalence of bronchial asthma in a random sample of urban compared to rural? Because if you remember the slide where I had put in the different flow chart, in an analytical study, you have to have a comparison group. This versus this, those who have this versus those who don't have this. So there has to be a comparison group. So a cross-sectional study can be both a descriptive study as well as an analytical study. Next, cohort study. Cohort study is wonderful because you can actually test your hypothesis by means of a cohort study. So if I am, for example, suspecting that smoking indeed does cause lung cancer, I now have the opportunity to actually look at smokers, follow up with them over a period of 10 years, 20 years, and eventually see whether they develop lung cancer or not. So what happens here? You have various groups which are made depending on presence or absence of risk factor. For example, I've taken the example of smoking, right? So I will put them as smokers and I'll put them as non-smokers, and then I'll follow up with them. It's a prospective study, yes, because you're looking forward. And here we can surely calculate the incidence rate, relative risk rate, and attributable risk. These are a few measures of association, which I'll get into later. So this is primarily the study design. We're having a population which is free of disease. Okay, the lung cancer has not happened yet. we are looking at exposure. How many of them are smokers? How many of them are not exposed or non-smokers? Among them, over a period of time, who develops disease? No disease. Among those who are not exposed, who develops disease? No disease. And then do your statistical analysis to finally understand whether this particular risk factor actually does lead to this particular outcome. The limitations of a cohort study, number one, it's not useful in rare outcomes because it's not all the time that a particular risk factor will cause that outcome, right? Number two, events may take a long time to occur. So like I mentioned in my own case, my own study, I might have to follow up with them for 10 years or 20 years. That is a long time to do a study, right? Large sample size, because of this also long follow-up time, and all of this is going to become extremely expensive. And there can be differential losses between the groups leading to bias and alteration of exposure status. Alteration of exposure status is nothing but, I've taken the example of smoking and seeing smokers developing lung cancer, right? Now, sometimes the smokers might want to stop smoking, or they might say, I used to smoke an entire pack of cigarettes a day, but now I've cut it down to half. So the exposure to the smoking has reduced. Naturally, I cannot tell my patients, please go and smoke, so because I want to look at the outcome, right? So that again becomes an issue when it comes to cohort study. Lastly, we have the randomized controlled clinical trials. So before I get to RCTs, is everybody okay so far? Are we on board? Have I just been talking to myself, or can I say, students, that there is something that is being delivered? Yes, perfect. Thank you, appreciate it. So coming to randomized control trial. This is the gold standard for evaluation of therapy and causal impact on outcome, right? So here there are extremely stringent exclusion and inclusion criteria, which is why it is one of the top things on the hierarchy, the pyramid of studies. So there is going to be exclusion inclusion criteria, which will reduce the chances of confounding. You have study subjects who are randomly assigned to treatment and control arms. Randomization is done and confounding factors are equally divided between the groups, and both study arms are subsequently followed up over a period of time in an identical manner, and finally you look at the outcome. Blinding also is done, which further reduces bias. So here with an RCT, you can actually assess causality rather than simply a correlation, which none of the other studies can do. So this is primarily the study design. Sample population, put them into two groups. Group 1 receives the treatment, look at the outcome. Group 2 receives a control treatment or the placebo, and you look at the outcome. Now, there are different types of study designs when it comes to RCT. Number one is your parallel design, which is a regular RCT, right? Where you have treatment group, control group, and then look at outcomes. You have something called a crossover study design, which is primarily done by a lot of drug companies, because you have a lot of pluses when you do a crossover design. How? Number one is, what is a crossover study design primarily? So you have treatment group A, treatment group B. A is receiving the drug, B is the placebo. After receiving the drug for a certain period of time, there is a washout period wherein both the groups will not receive any drug. And once that washout period is over, then the treatment group A will receive the placebo, treatment group B will receive the drug. So this way, both the groups will receive the treatment, and what is more important is that person becomes their own control. So when they were taking the drug, this is the effect. When they are not taking the drug, when the placebo was in place, this is the effect. So that is an absolutely brilliant study design. And I believe that most of the drugs trials are undertaking a crossover study design itself because of its superiority. Then we have our 2x2 factorial design, wherein you have more than one drug. You have two drugs to evaluate. So number one, the first group will receive both drugs. Second group will be A plus B placebo, B plus A placebo, and so on and so forth, until you have 4 different types of groups. And finally, you have the dose ranging studies, where you're trying to evaluate the different dosage of a same medication to see whether even the minimal dose can be providing you with the same kind of efficacy, right? High dose, medium dose, low dose, and a control group. Coming to confounder, which I said I'd explain. So primarily, a confounding factor is anything that distorts the association between an exposure as well as an outcome. So for example, I am trying to study in my study whether coffee drinking is a risk factor for a particular disease outcome, which is cardiovascular disease. Now, unfortunately, smoking here becomes a confounding factor, because Smoking also causes cardiovascular disease. At the same time, smoking is also very commonly associated with those who are beverage drinkers, right? So it has a hand in both E and O. That is a confounding factor. So whenever you do a randomized control study, you have to make sure that your inclusion and exclusion criteria are such that your confounding factors are equally distributed. So what is randomization? Randomization primarily helps to balance all the factors between treatment groups so that they are almost alike. There's allocation of treatments to participants, which is carried out using chance mechanisms so that nobody will know in advance what treatment group they fall into, and so on and so forth. Now, there are different types of randomization. Simple randomization is as simple as tossing a coin method of sorts, wherein if you are heads, you receive treatment A, treatment B, if you receive tails. Again, it's not typically a coin toss, but it's as much of a chance as a coin toss. So here again, only approximately half may be assigned to a particular treatment group and the other might be in the other group. The problem is that there's an imbalance here, right? Not everybody will be equally assigned to control as well as treatment group, and baseline factors might not be equally distributed between the two groups. So naturally, this becomes a very big issue when it comes to simple randomization, which is why we have a solution in the form of block randomization. So what do they do here? Let's suppose that we have two treatment groups, right? Treatment group A and treatment group B. So what do we do here? We find that we want equal allocation of this drug and this placebo between the two treatment groups. Create blocks. Okay, blocks will be groups. So depending on your sample size, you can either have groups of 4 or you can have groups of 6 and so on and so forth. So let's say I've taken a group, a block size of 4. Now in the first block, the order of treatment will be AA, BB, second block AB, AB, third block AB, BA, and so on and so forth. So what am I doing here is, as the patients are being recruited, they are filling the blocks. So I've recruited 5 patients. So first block is filled, second block only 1 patient is there, 3 more patients need to join. Then as and when the block gets filled, then the treatment is allocated. So what am I doing here? Number 1 is I'm making sure that I have equal number of patients in both treatment group A and treatment group B. And so there is fair and equitable distribution of the treatment as well as the control group. Now, one step ahead of the block randomization is stratified randomization. So let's say that, there's a particular baseline factor which might affect outcomes. So for example, if you're looking at a study on osteoporosis, age plays an extremely important role here, right? So you create a strata to say there are 2 stratas, first of all, those patients who are above 75 years and those patients who are below 75 years. And then among the strata, you do block randomization that way so that you ensure that there is equal distribution of the baseline factors. Yes, I'm almost done though. Blinding, what is blinding? Blinding is done so that you avoid potential bias caused by conscious or unconscious factors. Single blinding means only the patient is blinded. Double blinding, the patient as well as the assessing investigator is blinded. And triple blinding are even the person who's analyzing the data is blinded. How do you blind? You can blind the patients by using a placebo pill, which is looking exactly like the treatment pill in terms of color, shape, odor, everything. Or you can do something called a double dummy method, wherein in group 1, the drug will be blue and the placebo will be red. Whereas in group 2, the drug will be red and the placebo will be blue. So nobody has any clue as to what drug they're receiving. Why should patients be blinded? Naturally, because if they have a good rapport with their doctor, they want the study to be, giving favorable results. So they might alter their answers and they might have, preconceived notions. They might have a placebo effect, anything can be a reason for patients to lie. So always patients must be blinded. So I am Dr. Priya, I have measures of association. Before that, I have a quick quiz. Can we take that or shall I stop?
We can go ahead with the quiz, right?
Quiz, yeah. We'll do that.
So the remaining thing we can continue with the next talk if that's okay.
Perfect. Absolutely. Absolutely. So let's take a quick quiz. Doctors, I would really appreciate you if you will answer these questions. Okay. Tell me what would be the appropriate study design here. Okay. So I'm trying to evaluate association between use of statin and thyroid cancer. I'm trying to look at an association. So what would be the background here? The background is, just to give you a clue, observational studies have been done and that is suggested that maybe use of statin may decrease the overall risk of cancer and specifically colorectal cancer. So there's some observational study backing it up. What would you think is the right study design here? Anybody? So once again, the clue is only association. Okay. There's some answers. Let me see. Case control, cohort. Who has said cohort study? Analytical study. Absolutely safe answer. Case control, case control. Okay. The primary answer that has come through is case control. Good job. Correct answer. It is a case control study. Wonderful. Next question. What should be the appropriate study design here? Investigate hypothyroidism as a risk factor for thyroid cancer. So we're looking at hypothyroidism. We're suspecting it to be a risk factor. So looking at risk factor and then outcome. Perfect. Absolutely right. Cohort study. So this is a population-based cohort study, which is, so I'm taking examples, by the way, of actual studies. I'm not just making these things up. Right. Next question. To measure, again, doctors, this is not personal. This is just a question that I saw because this is an actual study. To measure the association between career satisfaction among obstetricians and gynecology residents and assess its relationship to burnout, depression, and malpractice concerns. What would it be? At a given point in time, we're looking at both exposure and outcome. No, not cohort. Because we are not going to follow up with the residents. Residents will not follow up with us to see if they're getting into depression, malpractice, or burnout, right? Cross-sectional, perfect. This is a cross-sectional study. Just to highlight, this is an actual study in the American Journal of Obstetrics and Gynecology, right? Fourth question. Whether PCOS raises the risk of developing uterine, ovarian, or breast cancer in women. Again, we're looking at risk factor and wondering whether it causes a particular outcome. Yes, there are some answers coming in. Cohort, absolutely right. This is a retrospective cohort. See, a retrospective cohort is also a cohort. Let's not get too confused. What happens is the direction is still the same in a cohort study from exposure to outcome. Only difference is we look at a different time period. That's it. Now, this is the last one to assess progression-free survival rate among those with I-131 refractory thyroid cancer who received levatinib versus those who received placebo. So I'm comparing a drug versus a placebo. What type of a study design would I have to take up? Is there answers coming in? Yes, RCT, absolutely right. The answer is RCT here. Standard, gold standard. Perfect. So I am going to leave at this point in time. Thank you so much for the time, doctors. Appreciate it. What I'm going to do is I will pass it on to the next speaker. We have another session coming up next time where I'll cover measures of association and other things related to research. I hope my talk was clear, and if you have any clarifications, you can please feel free to reach out to me.
That was a wonderful talk, Nikita. And you started with the 3 steps in conducting the study. 3 good things, that is review of literature, the good hypothesis, the good research question. And you have explained wonderfully the different types of study. And you have built it so nice. Everyone was trying to answer when you put a question. So that was really, really wonderful. And I really enjoyed it. It was a revision for us also. Thank you. Thank you so much.
Thank you. Appreciate it, ma'am. Thank you.
But how easy is to do RCTs in
clinical
settings?
It is a little bit of a challenge for postgraduates,
but still we can do it. Randomization, we can do it. Computer randomization, a lot.
It is not allowing randomization.
So,
ethics committee, because you know the one patient gets the benefit, the other doesn't get. So
ethics comes to.
Yes, ma'am. Circumventing ethics is the only drawback when it comes to RCT. Also, it becomes expensive for students also. So generally, they will prefer not to do an RCT.
We're doing only in observational studies.
Yes. But if
Just a
anything,
little bit of analytical study, little bit of intervention you can
yes. Yes.
add on.
No, ma'am. In an analytical study, we can, so many outcomes can be assessed, so many. So there's a lot of potential for analytical study.
RCT, mostly the drug company people, it's easy for us to do it. And this crossover study also, a little bit of bias is taken off.
Absolutely, ma'am. Absolutely. Most drug companies undertake a crossover study so as to emphasize the effectiveness of the drug. But when it comes to RCTs, one thing is, especially in surgical fields, I find that there's a bit more chance rather than the medical fields, in the surgical fields like OG and surgery, because there are active interventions. You can try surgical interventions also. So that's one plus for those who are in surgical fields. But again, cost comes into play. So it's completely subjective.
No, even then, no. Suppose if you are treating an inguinal hernia with an open method and a laparoscope method, definitely the ethics comes. When we know lap is better off.
Right.
So we are denying that group that thing. Little bit of tricky things.
Ethics. Yes, ma'am. Yes, that's very true.
Clinical RCTs.
Absolutely. So rather it should be more like there is a gold standard and there is a new drug coming or a new product coming in to try to see whether this is good enough or even better than. That is the only way to circumvent the ethics committee. Otherwise it becomes extremely difficult, like Dr. Kundavi rightly said.
Yeah, it was wonderful to listen to.
Thank you, ma'am. Thank you so much.
You made it very interesting.
Thank you, ma'am.
Simplified it.
Thank you, ma'am. Appreciate it.
Sambat, Dr. Sambat, can you introduce?
Yes, madam. Yes, madam. Yeah, so it's first of all, congratulations to OGSSI team with under Dr. Jairani and Dr. Kundavai starting the journal club. And the ideal person, Hepzibah madam, as Jairani madam told, first PhD in, I think in ROG in Tamil Nadu. So she has analyzed everything, cross-sectional, comparative, cohort. Fantastic talk by Nikita. Then we have the second speaker who will talk on Dr. Sudarshan, literature review. How do we get the right paper? He is a consultant fetal medicine in Mediscan, and his clinical focus is first trimester USG, prenatal diagnosis, and high-risk pregnancies. He has done many fetal medicine, multiple workshops on fetal echo, and he is adjunct faculty in Savita Medical College and PhD. He is the organizing secretary for CUSP. He was the Yuva Foxy orator in 2021. Puliki Parandadu Pune Aguma. Adepol Suresh, our son, Dr. Sudarshan Suresh, will give a wonderful talk on how do we get the right paper. Sudarshan, stage is yours.
Thank you, ma'am. Madam, you can see my slides in regular view or it's in a...
Yes, a little bit small it is.
Give me 1 second, ma'am.
If you go to slideshow, it will be comfortable. Okay, you can proceed, Sudarshan.
You can start.
Second, madam.
No, it's not in presenter's view.
Now it is correct mode?
Now, yes, now it is correct. Yes.
Yes. Thank you so much. Okay. I want to thank the OGSSI team for getting me to be part of this first session on research methodology. And so this talk is going to be on literature search and how do we do it the right way. And see, when when we want to go and search for literature, why do we even do that? We do it for the first and most important thing, to handle our patient. Because when we want to see a patient, we want to know how best we can run our clinical practice and how best we can do for our patient. And we want to practice evidence-based medicine. And for practicing evidence-based medicine, we need to be aware of what is the current evidence on literature available and what is the best literature available, and separate the wheat from the chaff. Second, we also need to learn how to do a literature search to understand scientific evidence and to do systematic reviews and to collate the various groups of evidence that are there to see if we can get some tangible result, and that tangible result ultimately will translate to an evidence-based clinical care. So literature review and research process are a continuum where you got to understand what topic you want to do and try to enhance our knowledge and add on to the existing thing. But when you say literature, what does it actually mean? It is simply a collection of scholarly articles on a topic. I use this word scholarly because it simply means that these are articles which have been written, published, and reviewed, or what we call peer reviewed. So when you look at the various kinds of literature that are available, you can go back and search for literature or data on a particular information. Say you want to get information on non-invasive prenatal testing for aneuploidy. You can go and pick up the latest books on that. You can go and look at journal articles. You can even go and look at conference proceedings which are published in journal articles as abstracts. And you can go back to some dissertations on a particular topic. For example, we had someone who we were part of a dissertation on fetal bladder outlet obstruction, where we had an author who came from Europe and included a lot of data from our unit as part of that study. And that dissertation ultimately, over a period of time, translated into 4 or 5 review articles, and paper, they are collated like this. You have some major publications on the same, and these major publications are ones involving a very large amount of data or big data, and they are run by large units. And then you have these multiple small studies, and these multiple small studies are all linked to these major publications in some way. And how can they be linked? They either add on to that existing data, or they spin off from that, or they're basically trying to reproduce what was published in a larger study, or it takes a particular area to fix on the area which we want to work, collate all the large studies that are there, pick up all the smaller studies which are linked to this, and see how our ideas fit into this, and it can change or add on to the existing body of literature. So when you have different types of literature reviews, these literature reviews can be selective literature reviews, which means we are trying to look at journal articles or course assignments, or you're trying to look at things which are part of a larger work, or you're trying to look at comprehensive literature reviews, which are like review articles or thesis dissertations. And when you want to look at the various elements in a literature review, you got to start searching the database, and these databases are searched from major formative works in the field, and then you go on to find the main ideas or theories, and you try to find out what are the gaps in that existing research in this specific area, and then figure out what context we can come to that. So unless we go back and do a complete research into what is available on that particular area, that would give us an idea of how we can provide our idea, our context into this particular thing. So these literature reviews can be of different type. These are very useful to work when you want to do your thesis area, your dissertation and all that, specifically for academic literature reviews. And these academic literature reviews require a lot of accuracy and require you to go through quality resources, and you have to analyze it thoroughly. Simple literature reviews are basically where we try to get an overview of the topic and they use common popular resources available. But in academic literature reviews, what we are trying to do when we want to work on an area, when we want to do a dissertation, where we go and look at various resources and pull out the best quality resources from that. And when we want to choose the research databases, then we have a number of research databases that are there. And these research databases can be from either PubMed search, they can be Google Scholar, they can be university sites. Like if you have, if you're part of a large university, say the University of the MGR Medical University, or say you're part of the Royal College, you have access to that. You have access to the literature on the website. Then you'll be able to get the research database and work on it. So what I'll be trying to do in this small session is try to give you a ballpark view of how to use these tools to go and search for the literature, because it's not a concept of where we go on to Google search and simply type what we want. We'll never be able to get the research article or the paper what we require for our need. So we need to know the methodology of doing the literature search in each of these databases. And this session will focus on that particular thing alone. So when you look at trying to search for literature, or when you try to look for articles on this, our focus is on what I said right at the beginning, the scholarly articles or the refereed articles or the peer-reviewed articles. And what are these peer-reviewed articles? A peer-reviewed article is one where there is an author who has published a paper and it sent it to a journal editor. And then the journal editor doesn't work on it. He sends it to a group of experts. And these are experts who work in the same field as that of the primary author. That's why they're called the peers. And they check the manuscript for accuracy, validity, and if appropriate, suggest revisions. And if they find the article lacking in validity, then they reject it. Because this paper has gone through a very tough methodology of processing, these are articles which we should look into when we want to search literature. So how do we look into that? When we go to a journal, I've just put up this slide for an example. This is the information on the New England Journal of Medicine. These journals which publish peer-reviewed articles have these information written inside them that this particular journal delivers peer-reviewed research articles. So each journal, when you go and look at it, you got to go and see if this journal publishes articles which have been peer-reviewed, or these journals are publishing articles which are not reviewed. These are only articles which are taken up and then published. So this differentiation is essential, because then the quality of the paper that we get, we are very sure of, and we are also sure of the content in that which we can apply to our clinical practice and for our own research. So when we go to the peer review, we go and check the format. We go and see if the whole article or the research paper is in a particular format. Peer review papers have got a very, very clear format. They start with the title, the abstract. It gives information on the word count. It gives a very clear division between aims, methodology, and limitations, and the end results of the study. And peer-reviewed papers always have a very clear bibliography by which these papers have been done. Similarly, tone of the paper. When you read the content of the paper or the article has got a very specific methodology of writing, which gives you information on whether it has been reviewed. For example, I have just put up this. This is a paper which has been peer reviewed, and look at the methodology of which the article has been organized. So on top you have the journal title and the journal issue number and the DOI, and then you have the title of the paper, and then you have the author and the affiliation of these authors. That gives you some degree of clarity on the validity of these authors who have made this publication. The paper has got a very systematic process. It goes to use some keywords. Let's remember this in our mind, because when we want to search for papers or literature articles, we use these keywords. For example, in this paper, it gives information on keywords that have been used are congenital heart disease, echocardiography, etc. This paper also gives an abstract. This abstract gives you what it is and how the search was done. This was a systematic review. If you clearly see here, this paper tells you how the database was searched for and what databases were searched for and how the databases were analyzed. It's got your result, it's got your conclusions, etc. And at the bottom end of the paper, at the lower end, you also have the journal and the issue number. And when you have a paper which has been organized in this kind of a systematic manner, and the journal title gives you that it's a peer-reviewed journal, then you know that what you're reading is a content which you can use indeed. Again, when you go and look at the tone of the paper, when you read through it, there will be hardly any errors in the syntaxes, and you will have a very formal tone of which the whole content has been organized in the paper. So that's a message on picking up articles. And when you want to pick up articles, the key message is look for peer-reviewed articles. And this is how you pick up a peer-reviewed article. Then we'll move on to how to do this literature search in the common search engines that we have. I call these search engines because these are specific things which will help you run what data that you want. And let's it on Google Scholar. And how do we go and work on Google Scholar? How I'm going to present it in this talk is I will put up the steps that we do in this, and then at the end of the talk, I'll go directly online and then show it to you real time on how we work on it. Some common steps that we need to use, that we can use when we use Google Scholar. This one, we try to use Google Scholar when you start using it in an incognito mode. What is an incognito mode? Incognito mode is a mode where it doesn't save you. Was on a topic on cardiac and a topic on a fetal venous malformation. So these keywords we've got to use in our mind, and these keywords help us on how the research actually goes through. And for that, we need to use Boolean operators. I'll come to what they are. And the third thing we need to remember is related articles. The fourth is utility of citations and searching within cited articles. And then we need to learn how to build libraries in the Google Scholar, and then we can create alerts to follow. These are the 7 tricks that we can use to use Google Scholar optimally when we want to do the research. And I'll put up some methodologies of the same. First thing which I said is use it in the incognito mode. You don't need to do it all the time, but if you do it, then you tend to get more recent research rather than the scholar giving you remembering your past queries and putting it on. Then keywords. What are keywords? Keywords can be either single words, there can be phrases. For example, I told in the previous paper that I put, keywords can be, say, if you want to search for something on preterm labor, and if you want to search on bacterial vaginosis and its association with preterm labor. So these are two phrases. Bacterial vaginosis is one phrase, preterm labor is another phrase, and you got to collate all these phrases together within these quotation marks. Only when you put them within the quotation mark, then only the phrase is searched together. If you use them alone, the phrase won't be searched together. The second methodology is the methodology of snowballing. What is snowballing? Snowballing is basically you take a particular literature and then you can go backwards and forwards to do more literature review from that. What is forward snowballing? It means you go and use the citation tracking, and backward snowballing is where you do reference tracking. So you use one particular article and use the citation tracking or the reference tracking to do further systematic literature review using that particular article itself. For example, this was a paper, this was a search engine done on aspirin for prevention of preeclampsia. So once this search was put up, these are the various papers that were put up in this search query. And right in that, I'm sorry for this position, you have some words here. You get something called cited by, you got something called related articles. So when you take this particular paper, say this paper is a review article on prevention of preeclampsia with aspirin, and if you simply go and click cited by, it gives you, it concises your research to these 105 results, which talks about prevention of preeclampsia with aspirin. And you can only search these papers to get more information, either for your dissertation or your literature review, or to learn more information on that. For example, this article, if you go into that, it has pushed us to various citations. It gives us information on overview of obesity and inflammation in preeclampsia. It gives you the recommendation of the ISSHP, the International Society for Hypertension in Pregnancy recommendation for preeclampsia practice. So a simple going on the cited review and the related articles gives you more related articles easily instead of we trying to search for these articles individually. Second is the related articles. That's the second click that I put here. When you place related articles, what has happened is that we've got all the articles that are related to aspirin and related to preeclampsia prevention. So just by clicking these related articles, I've got another 45 results. Our search has reduced from 28,600 results to specific 45 results. So that way we won't be swimming in that ocean, we'll be specifically going to one swimming pool, which has got information on these two areas alone. And these are more relevant and related articles. So we'll be able to save our time and looking at it. Just go and have a look at what are the related papers that I've brought up here. This is giving you information only on, say, prevention of preeclampsia, aspirin and meta-analysis and other systematic reviews, and helps us save a lot of time. And the third part of snowballing is our backward research. So when you get the paper, we go to the bottom end of the paper. You have all these references, and these references can be useful for you to learn more on that particular information. So the forward snowballing is looking at the cited articles and the reference articles and the related articles. A backward research is going to the reference at the end of this paper, and that will give you information on that. And then how do we build libraries? What is building libraries? Say you've done a lot of search of, say, 10 to 15 articles. When you press that save button, it asks you to give a label. And when you give the label, you can see that I have saved, I have researched 10 articles on preeclampsia prevention and saved them all to this particular Can you hear me?
Your voice is breaking in between. Till now
Yeah.
it was okay.
Now it's okay. Now you can
Now
hear.
it's okay.
Now
Yes,
it is
now we
okay.
can hear you.
Okay. So we will be able to see the different articles inside this specific area, and we can work on that. The next thing you can do in Google Scholar is create alerts. What does create alert mean? Create alert means when you pick this create alert, what happens is that whenever a new publication happens in this particular area recently, automatically this sends you an alert email to your registered mail ID, and you can go and have a look at that new information on that particular article immediately. So you can build libraries to collate all the evidence that you have collected. You can create alerts for you to go and search on these particular papers at a later time when newer references come up on that. So these 7 steps will help you optimally use Google Scholar in the best possible manner. I shall go at the end of this whole talk to work on each of this in the in real time and show. The second literature search is you can go to university journal sites, and for that you need to have access for each particular thing. I've given you an example of accessing to the Royal College Journal website, for which we have an access. And when you go to that journal references for that, you simply go there, you can see this whole page. This is an example of the RCOG link page. You can search different journals as per the title. You can do an alphabet-wise search. It also has got a large compendium of various books that are there and specific e-journals that are there. Say, for instance, if I want to go and search for the British Journal of Obstetrics and Gynecology, I can go and click on B. I'll be able to go to that particular journal. For example, I click B and it gave me all these 4 journals. It gave me best practice research. It gave me basic and clinical andrology. And what I can do at the end of getting these 22 searches of this is I can limit my research using these specific tools. And when you go to this, wherein our search will be limited only to those journals which publish peer-reviewed articles. So you're trying to make your research and your referencing more and more robust and more specific and authentic. And once I clicked on peer-reviewed journals, see what has happened. My search query from 22 has come down to 4. These are the only 4 journals which publish peer-reviewed articles in all these journals that are there that have been seen on the previous screen. And I can do more specific queries there. Once I go into that particular journal, say I've gone to this best practices journal, the moment you click there, it gives you, we can only look at journals which have got full text papers. I can only look at meta-analysis. I can only look at RCTs. I can only look at guidelines that have been published in that journal. So I can concise my search in that particular journal to the kind of papers I want. Say, if I want to update myself on all the recent meta-analysis that are being published, say, in the British Journal of Obstetrics and Gynec, I can simply go to the journal, click on meta-analysis here, and only get all those papers here. And that gives you my overview of that information that is there. The second thing that I can do is I see what I've done. I've gone to journal references in this, and I've clicked 2 search terms. I said we use keywords, and I said we need to put those keywords in quotation marks. So the 2 keywords that are there are I wanted to search information on progesterone and utility in preterm labor. What is the evidence? So I have put preterm labor under double quotes. I've used the Boolean operator and I will give you more information on that. And I've put progesterone under double quotes. Once I've put both in double quotes and I put the query and, I've got very specific 13 results, and I wanted only guidelines and journal articles. There are only 11 guidelines and 9 journal articles on that. So my specific search is very, very easy. So if I put my keywords under quotes and go and filter the search as to what I want only, then it will narrow down our search. These methodologies of searching would prevent us from skimming around our routine Google search. So the last search engine with which we can specifically go and do literature search is PubMed, and learning to do PubMed search is a big area by itself. I'll focus on teaching only some specific points in that and show that because then it would, and maybe probably in some of the meetings that we go on, we can understand it in a little more detail. So when we go to the PubMed page, you've got the search query box, you've got something called advanced search, clinical query, citation matcher, you've got something called the mesh database and the journal database. So let's only look at 1, 2, 3, 4, and 5, these 5. Advanced search, clinical queries, citation matcher, mesh database, and journals. So let's look at each one of them, one slide each. Clinical queries. PubMed clinical queries uses predefined filters to refine your search on a specific clinical area or a specific disease topic. So you can enter the search terms in the bar and filter it to what kind of treatments that you want. For example, I have put here, suppose I want to go and look for treatment of preterm labor. I can put preterm labor here, put clinical studies, and look at, search my clinical filter into, say, diagnosis of preterm labor or etiologies of preterm labor or clinical prediction guides for that particular area. So I can delineate my clinical query very easily by simply putting clinical query, clinical studies, and give one filter. Very simple method and will save a lot of time. The second search is a journal search. Journal search is a routine search that you do. You enter the topic or the title of the journal. Say you want to search Indian Journal of Obstetrics and Gynec. You can simply put that here and then put it on search query, and it will give you all the articles in that journal. Something's called citation manager. Citation manager means you know what area, you got more specific information on the paper that you have. So then you can go and type the journal name, the date, the volume, issue, and author name. You can fill in whatever is possible and then put a search. Then you can get the search engine. For instance, if you know that a particular paper has been published in the March issue of 2022 in the Indian Journal of Obstetrics or Journal of OGI, then you can put the journal name, put the title and month. And even if you don't remember the author name, you can put the, you can only use the first author and then search, then you'll be able to come to it easily. Then we learned the term called automatic term mapping. Automatic term mapping means when you go and put a search term in the search box, all the terms are automatically mapped to the mesh terms. I'll tell you what mesh is. And when you put a quotation around the phrase, then it turns off the automatic term mapping, which means when you put a quotation under the word that you use, then the words are searched exactly as entered. So if you put under quotations, say preterm delivery, then it searches that exact word in all the papers that are there. If you put only preterm delivery without any quotes, it searches all the papers or information related to preterm and related to delivery and gives you more louder search. So how do you collate the search? We use these operators, some messages on each of these operators that we use. For example, what is the OR operator? The OR operator on non-invasive prenatal testing or non-invasive screening or cell-free DNA screening, I can use the OR operator because these are terms which are very, very similar to each other. And when I put that, this will give me all the articles which have got information on either NIPT or NIS or cell-free DNA, because I know that these are all related terms. I can use this operator to search for that. The AND operator I can use is, for example, I wanted to search on preterm labor cervical length. I've used this AND operator. It's got to be in capital letters, minded. You can't put it in small letters. It will link ideas and concepts when you want to see both in your search results. For example, I want to see articles which have only been published on utility of cervical length assessment in prediction of preterm labor. Then I need, these are papers on preterm labor. These are papers on cervical length, and these are papers which include both only. So when you use the AND operator, it picks up only these combined papers. So when you use these operators specifically, then your research or literature search will be more specific. A very, very new entity that has been added on to the PubMed search is the proximity search. A proximity search is very useful. You use the words on the title. For example, I want to have the words NIPT and amniocentesis in my title of the papers which I want to search for. So I put NIPT and amniocentesis under double quotes. So first step is that you take the words that you want in your title or in your abstract on your body under double quotes, and then you use the second operator which says, I want to see these words in the title bar abstract, and use this symbol. You can take a snapshot so that you know what it is. You use this symbol, and then I put 2. What does it mean? Which means in my title or my abstract, I want information which gives NIPT and amniocentesis, and I don't want more than 2 words in between them, which means I'm making my search very, very, very specific. For example, once I put this, it's given me only 15 results, and all these results give me information on NIPT and amniocentesis. For example, this paper gives you comparing non-invasive prenatal testing with invasive testing for detection of trisomy 21. And because I've used it in this search engine, mesh search engine, automatically the search engine understands amniocentesis is a similar mesh term for invasive diagnostic testing, and it has used that as part of the search. And inside the bracket here, I put these search titles, title bar abstract. How do we know what to put? These are our search field tags that you can use to make this search easy. Common search field tags we can use is, say, under double box, AU means author, which means we want to search articles only on this author. TI is search articles with this number on the title alone, or TIAB, which means I want these articles in the title or abstract. For example, I've put this PubMed search on antepartum hemorrhage. Under boxes, I put TI under big boxes, which means all the papers which have antepartum hemorrhage in title alone have been
Hello, Sudarshan, we can't hear you.
For example, I put preterm labor TI and cervical length TI because I want this and this in the title. So when I want only this and this in the title, only this and this in the title have been given. Similarly, I can use a lot of filters, and these filters are there on the left page. Like in the journal article, I said, I want only papers published in the last 2 years. I want only full text articles. And once I filter my search from 30,000 results, I come down to 180 results as less as possible. So that's how you come down or reduce your articles. And once you go into an article at the other end, you can have similar things called cited articles, similar articles. You can search things also like that. And so once you have got all this data in that, you got to use an Excel page in your system, you can create your own Excel page that can have, for example, I've given you some titles like this, so that you can enter all these things in that, so that you have your collation of the different papers that you have read, you have searched, and you have put up, so that when you want to go back and have a review, it's much easier to go back to this Excel to know what kind of papers that are there. With respect to this mesh search engine, mesh is basically a short form for medical subject headings. It's just a standardized terminology, and it's used to build searches which are more specific. I've again used a simple mesh term for preterm labor. I will skip the slides because I'll do it in real time in the talk. For example, I've gone to use this specific mesh term and searched very specific topics that are there, which have gone into these terms and done. And you can build searches. For example, I have done searches on preterm labor. I've done searches on progesterone. I've done searches on cerclage. I've done searches on cerclage and twins. Once I've done different searches, what my search database is, it's collated all these references results together. Then what I can do, I can combine both. For example, I can combine cervical cerclage and preterm labor 1 and 3 together. So what the search engine will do, it will search all the papers which talk about cervical cerclage and the utility in preterm labor prevention. So that way, if you have done different research on different areas, you can combine these searches in this advanced search builder, and that will again help you save time in going to individual search queries. For example, here I have 1 which is preterm labor, 4 is cervical cerclage and twins. I've combined 1 and 4. So if you look at this, it's given papers only which gives you information on cervical cerclage, twins, and preterm labor. Let's have a look at one example. So this paper gives you FIGO good practice recommendation on cervical cerclage for prevention of preterm birth. It gives you information on multiple pregnancy. So that way, you will be able to collate your research article to only very specific papers that you have. And the last thing which I want to put a note is mentally, I think this has to go on a different session in this meeting. Mendeley is again a method, a database which you can download in your system. And once you have different articles which you have downloaded, you can just drag and drop them into this. It will simply organize whatever research that you have done based on the author, the title, the year published, and you can combine them into different things. For example, this is my Mendeley research page. I've collated all the articles that I have published and researched into these different areas. So if I want to go back the next time and search, I can simply go and click this and get all the information. This I've clicked on fetal heart, all the information on that will be published. So I'll just stop my session here and I will go into sharing my screen. One sec. I will share my screen. Okay, can you see the screen now?
Yes, sir.
Yes, great. So give me a second. Yeah. So this is how you go and put these different search engine. When you put it on PubMed, this is the page that you will get here. And this is what I told you. You can search in various databases. For example, I can just click on this MESH database. It will go on to this MESH database. And in this database, I will zoom it for your information.
It's clear. We can see it, Doctor.
For example, in this mesh database, I have put a search on, say, So I'm putting a search on amniocentesis. So once I put this search on amniocentesis, see what it gives you. It tells you what that information is on, and it gives you our PubMed search builder, and it gives you a lot of other sub areas on that. You can look at all the subcategories. So two things only we look at. For example, we can go and look at, if you say amniocentesis, you can say search articles only on methods of amniocentesis. You can search articles only on instrumentation for amniocentesis. So you can restrict your search only to that particular topic. That's called restrict to mesh major topic. So I have restricted it to these major topics. And once you have clicked these two, you can see in the search builder, it says amniocentesis bar instrumentation major topic only. And then I say search PubMed. So if you can look at it, I've got only 24 specific results over all these areas. So if you look at the papers that I've got information on 3 years experience of using 29 gauge atraumatic needle for amniocentesis. Comparison of complications of amniocentesis performed with 20, 21G, 22G, which is preferred for amniocentesis 20 or 20G. So a very simple method where I want information only on instrumentation. So I've got the search on instrumentation. So very similar, say if I want the same topic, I put preterm labor. So I want only information on therapy for preterm labor. Okay, I'll restrict it to major topic, add it to a search builder and search. And when I search, I've got specific results. So now I've got all these results. I want even more specific results. What I want to do, say, I want only the systematic reviews on this. I've got only 272 results. I want only systematic reviews in the last, say, 5 years. I've got only 97 results. And I want only which has got free full text articles. I've got only 43 papers. So I've got all the 43 papers which I want in this specific area. And this way we'll be able to search this. So if you got some other things here, you got something called save, which means you can save it to your search builder. You can email this search to yourself. And you can look at this. There is something called advanced search query. I click that advanced search query. See what has happened. It gives you all the search history that you have done. Okay. I've got search done on so many topics done. I got all these papers there. Say I want papers on NIPT and amniocentesis. Or amniocentesis. Now I can do a search. Now what PubMed has done is taken these two searches that I've done and collated them together and given me 38 specific results. And these 38 specific results only give me information on that. Say now, when I use the search Boolean operator and see what has happened, I'm not getting any information. And that information I'm not getting because these information are not within your specific codes. And for that specific reason, okay, so I will give you one more search. I told you that we can use the title query. See, I wanted information on NIPT amniocentesis in the title. I want only 2 words separating them. I've used this abstract method to go and do that. So this is the method by which you can enter the different search queries, build advanced search queries, and collate the different searches that you have done and combine all that to give your data. I can save all these search queries and that will give us information. One simple example, for example, I wanted to get information on what do I do when the nuchal translucency is between 3 to 3.4 mm. And I did the PubMed search. It took me to this particular paper. This particular paper gives me information on the nuchal translucency 3 to 3.4. Is it an indication to do an invasive testing or an IPT? it gives me all that information. I can go and look at the different and similar articles in that. So this immediately gives me all the similar articles which talk about invasive testing or non-invasive testing when you have advanced increased nuchal translucency on a structural malformation. So utilizing PubMed more optimally can come when you know these specific techniques. Utility of the Google Scholar is a very similar. I will just put one information on that because it's getting really late. I just want to get information on progesterone. Say it gives me all these results on progesterone, and say I want only review articles. It reduces this. I want review articles which have been published only since 2022. We've got all these articles that are there, and I can go and create my library. This is my library. I have created, as you can see earlier, a library on preeclampsia prevention. I have taken each specific article. What I've done is I've saved these articles. Say I've saved one article, I can create a new information on, say, progesterone, and now I can add all this to this particular library, and I've added this also to this particular library. And now when I go back to my library, what can happen is the articles which I have saved from the search is there in my library. I don't need to go every time to Google to go and search all these papers that are there. So this methodology will help you collate these articles and go to specific articles.
How
so
to save? I didn't get that.
Okay.
How do you save?
Yeah. So you go to this paper. You have something called, okay, let's use, let's take the term again, unossified nasal bone. Let's take that. It gives me so many information in fetus. Okay, it gives you, you got to put it under quotes. So I need these terms together. So I put it under quotes. So I've got all this information on bacterial vaginosis. There you got next to the star, you got something called save. You click that save, and then you create a new label. And that new label you can give whatever short form. I want bacterial vaginosis, I put it as BV. So it's gone to that. So I want this paper on role of antimicrobial resistance in refractory bacterial vaginosis, current recommendations, 2022 publication. I'll save it, go to BV, and done. So now I go to my library. My library of BV has got these two papers saved. I can delete it anytime out of my library. When I feel that this paper have become outdated, I don't want this, I can delete them. So these are some simple things that you need to know when you want to use it. A more robust search of utility of PubMed for doing literature search. It requires a long session where I got to go through it step. I think this beginning.
We'll give you another day for that, not now. Already
here.
our audience are tired.
Yeah, we should stop it right here.
Yes.
Thank you so much.
It was a very nice session. Like, you kept us, we could not leave the meet. We were like, just there tied up.
Definitely, I think should talk in physical meeting with PGs from OGSSI, we will arrange. So really, it is needed. I think even in the revision course, it can be included. Definitely needed. Thank you so much.
Thank you, ma'am. Thank you.
They all have to pass that exam in the first year itself. It's a mandatory now.
Okay.
Good. Extensive work and extensive. Excellent.
Lot of learning points. We have learned lots today. As Priya said, can't come out of it even for a minute.
Good.
Thank you.
Thank you for the nice nice session on a research methodology and thing, and very nice initiative. I should congratulate Jairani's and Dr. Kundavi's effort on this.
The dry subjects were made into a very lively subject.
We should give another 1 more hour for Sudarshan on another meeting.
So we'll make Sudarshan and Nikita all as experts, so that they can all be there before every journal club. They can have each talk about what they're going to tell them. That will make the process a proper channelized one, so that every aspect of research methodology can be discussed in that. So I think, Nikita, you have still how many modules you have?
6 modules.
I have reduced it to 4, ma'am. I've only put in the required data.
So
Okay,
that'll be fine. So I think we can have in between
Yeah,
one physical, we can have 1 day. But probably we can have this as a routine on the second Tuesday to have a regular journal club.
Yes. So,
Thank you,
Chitrakala, you still there?
Really, very good.
Yes, ma'am.
We have seen a lot of different aspects.
Chitrakala is that is because we are all there. If Chitrakala shuts down, we cannot be there.
No, madam, we just have 1 more slide. So that's why I asked.
Yes, my vote of thanks.
Yes, madam. So I call upon our secretary, Dr. Kundavi, madam. Madam is a consultant in Triple M Hospital. Everybody knows her, so I don't want to bore that. Yes.
Yeah, it's my pleasure and an honor to give this vote of thanks in this prestigious journal club meet. And first of all, I think we should thank the Almighty who has given us the strength to introduce this journal club program. And sincere thanks to the dynamic president for OGSSI, Dr. Rishikesh Pai, who's joined us in spite of his busy schedule, and Reshma Pai for the lovely support and to this journal club. And sincere thanks to all the special guests like Dr. Geeta Palsarkar and Dr. Jyotika Desai and Dr. Sureka for having joined us for this journal club. And thank you, chairpersons, Dr. Hepsi ma'am, the right person to be here for the first, the initial inauguration of this journal club, I think. And the dynamic VP, Dr. Sambat ma'am, you name a place, she will be there the next minute. So thank you, both of you. And the speakers, Dr. Nikita and Dr. Sudarshan, the dry subjects, what we were thinking, you made it very, very lively. It's like an ice cream. You took it, and I don't think we are, we're not even a minute we were able to come out of your talks. Thank you so much. And the special thanks to the delegates who stayed with us. And especially the special thanks to the dynamic president. Today, her dream has come true, Dr. Jayarani's, because she has been talking about the journal club for a long time. And I'm grateful to Dr. Jayarani for that. And we have an young dynamic, Dr. Priya Kannappan, who's going to take this session forward. Priya, the OGSSI has given you the platform. Keep rocking. And a special thanks to Shield for this Zoom platform to us.